Some of us in our families or in our homesteads, we get cuts, and some of them are deep cuts. What must be done as first aid for the cuts in our families? When somebody gets a cut at home, what you need to do is focus on preventing bleeding or stopping bleeding. Number two, focus on avoiding contamination of the wound. That is, avoid introducing infection to the wound or limiting contamination to the wound. Then, what must be done in avoiding or preventing bleeding? Raise the cut part of the body that is above the level of the heart. Case in point, if it's a finger that is cut, raise it up. It means the force of gravity is going to be making sure that the blood which should have been flowing to that part won't flow, rather the bleeding will be less. Or alternatively, if it's the foot, then raise it up. That way, the blood which was flowing towards the foot is going to be a little bit limited, and therefore the bleeding will be less. But in each and every part of the body that is cut, there are some other parts which you cannot raise. That way, the most important bit is the next step, is you get a clean piece of cloth. Or if you have cotton, get cotton and apply it on the surface which is cut. Then you tie. As you are tying, you make sure you apply enough force to ensure that there is a stoppage of bleeding. Or if at all you are applying, make sure that you are not applying excessive force to stop blood flow, but you're just applying enough force to stop the bleeding. And that is the key in achieving hemostasis, which you call stoppage of bleeding. The other thing to ensure is that if the cut surface has been cut by an object that has been so dirty and you are able to see visible dirt, what must you do at that point? You get soap and water. You clean the area with the soap and water, then you apply your cotton or a clean piece of cloth, then you tie the area properly to ensure that bleeding stops. In case a cut is on the head, then this way, because by virtue of the head being above the heart, it means the bleeding is expected to be less. But this way, what are you expected to do? Get cotton or a clean piece of cloth and apply it on the cut surface, then you tie. In this case, we expect you to tie. If you have a crepe bandage, you can tie with a crepe bandage. If not, you can use a handkerchief. If not a handkerchief, you can use any clean piece of cloth that you can wrap around the head to make sure that you are attaching your cotton or clean piece of cloth to the cut surface to avoid or stop bleeding. Then transfer the patient to the nearest health unit to ensure that you seek for medical care, in which case they are going to apply an antiseptic solution on the wound surface, and after which they are going to give a painkiller, and they are also going to give an antibiotic. That is a drug to stop any bacteria from entering or to destroy any bacteria which have already entered into the wound, such that the wound does not get infected. One of the key elements that are going to be done in the health care unit where you have gone, we expect a tetanus injection to be given to the patient, though it will depend on how long ago the patient was last vaccinated against tetanus, because if it is within 5 years period, it does not get an extra dose. But if at all 5 years have gone by, then it's going to get a booster dose for tetanus. And for some of you who are not vaccinated at all against tetanus ever since your childhood, then at this point in time, there's no question about that. You're going to be getting the tetanus injection.